Today I'm here at the Einstein Medical Center, Philadelphia, with my special guest, Dr. Chani Yondorf. It's a pleasure to meet you.
Same here.
Dr. Yondorf is a member of Einstein OBGYN, and while her medical practice treats all women, she has developed a unique focus on caring for the needs of frum women, offering these women an opportunity to work with a doctor with personal expertise and understanding of the laws of family purity.
Mm-hmm.
In addition to this unique role as an obstetrician and gynecologist, Dr. Yondorf also plays an important role in Einstein's Victor Center, which we'll talk about a little bit later. Mm-hmm. Dr. Yondorf grew up in Long Island and attended Yeshiva University and Albert Einstein College of Medicine. So welcome, and thank you for being here with us today.
Thank you for having me.
First, share with our audience a little bit about your journey in becoming a physician, and specifically an OBGYN, a branch of medicine that requires a lot of sleepless nights.
Certainly. So my mother, like every good Jewish mother out there, was determined that I was going to be the first doctor in the family. And I was determined to prove her wrong. So I spent all of my college years focusing on anything but medicine, trying to find something else that I wanted to do, until my senior year of college, when I realized that my mother was right. And then I decided to go back and go to medical school. I just found that the human body is so complex and so fascinating, and the way that God created us was amazing, and I wanted to just learn more about it and know more about it. And then when I was in medical school, trying to choose my specialty was also something that was very difficult for me. I just liked everything, and so I had a very hard time picking something that I was only going to do and neglecting everything else. And I found OBGYN to be just very rewarding, because you take a woman and you can follow her throughout her entire life. And, you start off when they're young, teenagers, and you grow with them through the happiest times of their lives, and then are able to transition with them through their menopause years as well. And it was just something that I found on a personal level very rewarding, and that's what drew me towards it.
That's beautiful. It's very beautiful. What unique and special talents do you provide frum women with, being a frum woman yourself?
So, I think that OBGYN is a field in particular that has a lot of overlap between a woman's religious needs and a woman's medical needs. And it's very hard, the medicine can be taught to any physician in medical school, but that religious component is really hard to teach. And it's kind of the same like when you have like a patient-physician interaction in a different language. When your patient doesn't speak the same language as you can get a translator service in and you can get through that patient visit, but it's definitely not the same as when the patient and the physician speak the same exact language. And I think the same holds true here. I speak the language, I live the culture, it is part of who I am as well, and so nothing has to be taught, it's innate in me, and that just, creates an immediate connection between me and my patients.
So you can be much more empathic and understanding of their needs,
yeah,
both religiously and medically.
Mm-hmm.
Okay. Can you tell us some of the specific ways your understanding and sensitivity to the laws of family purity make your practice unique for an Orthodox woman?
I think that one of the most difficult things about coming to a gynecologist as an Orthodox woman is trying to explain to them why what you're going through might be problematic for you. And when a woman comes to see me in the clinic, she doesn't have to go through that explanation portion of it. And, I remember personally, the laws of family purity, they affect me personally too. I go through it with my patients, and so I'm there with them. And I share in their frustration because I live their frustration as well. And I share in the beauty of it because I live in that beauty as well too. It's not always about the frustration component of it. I remember very, very distinctly my first, visit to the gynecologist before I was getting married, and how difficult it was for me to explain to her why I needed my period to not fall out on my wedding night, and why that was so so crucial to me. And when a young bride comes to see me in the office, there's no explanation necessary. And that's just one particular example. The same thing carries through for any Orthodox woman throughout her lifetime. When a woman comes to me, she doesn't have to struggle to explain to me why the spotting is problematic for her use of the mikvah. I got it, I just get it.
It must be very reassuring to a young woman that she doesn't have to explain all these things and feel in any way unusual in explaining them to another doctor.
And especially a young bride who's just learning these laws for herself, or she's not 100% comfortable with them yet, and try to explain that to somebody who has no idea what you're talking about. It's difficult.
It's very unique. So a female can see a gynecologist at obviously any age. Are there some specific religious concerns that you address at various stages of a Jewish woman's life?
Yeah, I've actually been working with a bunch of the Jewish day schools in the neighborhood to go to their schools and speak with adolescents in their preteen and teenage years as they go through, puberty, explaining to them what's going to change in their body and their mind. And this is a topic that can be really taboo for a religious girl, and to try and take away that fear and take that mystery out of the process and explain to them that this is just God's way of creating the powerful woman body. Women are amazing. What our bodies do is incredible. And to try and put it into that light for those young girls is, something that I find very rewarding. And so that's where we're at when it comes to like the preteens and the teens. And then when women first get married, helping them, I am in contact with a lot of the kala teachers in the area as well. And they call me with all times of day or night with any of their questions that they might have that come up when they teach their kalas, their brides. And then the flip side, they send their brides to me for their first GYN visit. It's all very rewarding, and it creates a nice partnership for the bride between her kala teacher and her gynecologist that like we go hand in hand together. And then later on, as they first get married, and to be able to talk to them about, the birth control issues that come up or intimacy issues that come up for these women who've never had to struggle with this at all. Being willing to speak to their rabbis for any questions they might have. It's just something that's very comforting for women. And then finally, guiding them through the rest of their reproductive years. And then as they transition to menopause, which is their next stage of life without the need for the mikveh, and how to kind of come to grips with that is just, something else that I'm there for them.
That's a beautifully rewarding experience. The Victor Center at Einstein was established with an extensive program of genetic testing. What actually is genetic testing? What are the tests done to detect various problems? And what, if any, are the ramifications for the mom and or baby if an anomaly is discovered?
So the Victor Center, it's an incredible institution that was set up to help empower young Jewish individuals throughout their reproductive years, and even prior to their reproductive years, just take control of their reproductive lives. Because Jewish genetic diseases are preventable, and 1 in 2 Jews carries a genetic disease, and 1 in 100 couples carry the same genetic disease. And for these young couples, it's still possible for them to get pregnant and have healthy children. But the knowledge is what they need. Knowledge is power. And to be able to come to the Victor Center and obtain the knowledge of what your genetic makeup is and what it might mean for you in your reproductive future is, something that's very special that the Victor Center gives us. And in terms of genetic testing, there's different kinds of genetic testing. So the Victor Center focuses mainly on, before women are pregnant. It is testing for couples when they're starting to think about, having children, and to know what their underlying risk of genetic diseases are. Genetic testing during pregnancy is a little bit different. That is, it's a test that's not specific for a Jewish population, but all people are at risk of having a baby with abnormal chromosomes, so Down syndrome, extra chromosome 18, 13, 21. That is the genetic testing that's generally done during pregnancy. And that, for some women will mean that, they're going to find out that information, know that the baby is abnormal, and terminate the pregnancy because it's not something they were looking for, or they don't want to bring an abnormal child into the world to suffer. Some women will find out that they have a genetic abnormality with their baby and use that information to plan their delivery. You know, I'm going to plan to deliver at a hospital that will have the capacity to take care of this child that's abnormal. Or not even if the child doesn't need any extra care, just to know what they're getting themselves into, to be able to create their home in such a way that will allow for a child with disability, to prepare their future to be able to take care of a child with disability. So there's, you know, a lot of implications for a patient, for a mom and her baby when it comes to genetic testing during pregnancy. And it can be used in like a myriad of different ways to help that couple come to grips. But there is a genetic counselor who works there, and he is phenomenal. He does all of the pre-counseling before the testing is done, and then after testing is done, if anything is found to be positive, he's there to, again, discuss it and counsel patients.
That's wonderful. Well, I'd like to ask you how women can learn more about you and your practice at Einstein.
Well, I mean, they can, you know, go on the Einstein website. The OBGYN portion of that definitely has my information. You can call the office to just set up a consultation meeting with me. I'm very available. I have lots of lots of flexibility in my schedule. So.
Okay. Well, I want to thank you very, very much for this wonderfully informative discussion. I learned so much, and I know that your schedule will be filling up as a result of this presentation.
Wonderful.
Thank you very, very much.
Thank you.